during my training as a Pilates teacher, we placed a huge emphasis on the core, breathing, and the psoas, a muscle called the psoas, and learning the origin of the psoas and its insertion and its function. So the main kind of points were that it joins the spine to your thigh bone, right? It's involved in flexion, it's involved in rotation, it's involved in maintaining the integrity of the spine, and that's what we learned. And if it wasn't for that, I wouldn't have arrived in my somatic practice. So we were so involved with, how do we find ways to release any tension or stiffness in the diaphragm, and how do we restore the integrity of the psoas and its function. So what I learned with fascia and my fascia education is that those two things are not separate, and in fact the fascia is continuous. Your psoas that you learned that was separate to your diaphragm are actually continuous with each other. They have a particular way in which the forces run through them, but they are continuous. They're continuous with the arch of your foot, with your pelvic floor, with your tongue. So this inner container of your body is continuous even with your thoracolumbar fascia, right? So now, how do we restore the integrity of the psoas? One way is with pandiculation. So that urge that happens intuitively and spontaneously involves revitalizing the tissue. So if you've been inactive or sitting for a long period of time or not moving with ease because your fascial tissue is compromised, we start to explore these motions. So for me, pandiculation was this aha moment. It was kind of, wow, if we could explore this intuitive blueprint, it's going to help with breathing, with restoring the integrity of the psoas. So not only is pandiculation known in this way, that urge to unwind and revitalize your body's way of restoring the integrity of your fascial tissue, it happens in so many other ways. What I call a pandiculation reflex. So when you're folding forward to pick something up off the ground, the body takes in a spontaneous in-breath and self-stabilizes you. So this is where we start to tune in to the nature of our design and find motion that moves to that natural design, which will be effortless, and you won't have to separate your psoas. There are movements that emerge that allow you to step back and simply touch the ground, and that's involving your psoas. That in-breath involves your psoas. The body finds this expansive motion. Okay, so if there's some other videos on pandiculation that I've posted here, that urge to happens, the breath arrives, there's an expanding sensation, and then there's a sigh. So if you want to restore the function of your psoas, you want movements that involve this pandiculation motion or pandicular sensations, and they happen always spontaneously in your body, intuitively. There are also rocking, coaxing motions. So here's a little practice that I would encourage you to explore. A practice that I call inner balance. When you are in integrity, balancing becomes really effortless. So I'm here, I'm not pulling my core in, I'm just allowing the body to rest, and here we are. This is a practice that I call inner balance. And when your body comes to rest, what happens is this intuitive motion. So the body will find these oscillating movements, what fascia people call micro movements perhaps, but they're spontaneous, right? So when you find this resonance within, or this resonance of your connective tissue, this is what happens. And if that's not happening for you, if you're standing and you're in stillness completely, then it won't happen for you if you don't find that softness within, that place to rest. And then, this is a great way to tune your psoas, right? And on this side, you can see it's different to the opposite side, right? Different. The other arm is being involved. And then what happens is the spontaneous motion. You'll find kind of a spiral motion that's happening within the body. So to learn more, join me on one of my courses, or you can connect with me on a one-on-one, or look at becoming certified in this fascia tuning therapy.